If a patient walks into the emergency room with suspected Ebola virus symptoms, there are protocols in place to minimize the spread of infection and protect the hospital staff.
Hi, good morning.
Hi.
Are you here for the emergency department?
Yeah, please.
What brings you in today?
My daughter is not feeling well at all. She's very sick. Definitely has a fever.
When a patient presents with a fever, please verify immediately if they have traveled outside of the U.S. in the past few weeks.
Any travel outside the U.S. in the last few weeks?
Yes, we just actually got back last week from West Africa.
If the patient answers they have traveled to a country where Ebola transmission may be occurring, it is imperative to notify immediately the hospital staff that a possible Ebola patient has entered the emergency department.
Okay. Because you travel to a high-risk area, we just have to take a few extra precautions, okay? First, I'm going to have you both put on one of these masks. I'm just going to call and get that room ready.
Room 45 in the ED has been set aside as the treatment room for suspected Ebola patients. Once the triage nurse has concerns of a suspected patient, they must call the charge nurse to set hospital protocols into motion.
ER, this is Denise. How can I help you?
Hi, it's Kathy. I'm at triage. I have a young lady checking in with fever and a positive travel history, so we need room 45.
Oh, okay. I'll get room 45 set up for you right now. Thank you. Bye.
Once the charge nurse has been notified, they will assign the task of preparing room 45 for a potential Ebola patient and call the attending physician.
Hey, Lauren.
Yeah,
Can you do me a favor?
sure.
Can you please page infection control and let them know we have a potential Ebola patient here in triage that needs to
Okay.
come back to room 45?
Okay,
When you're done with that, then can you please page the attending and let him know?
you got it. I'm gonna page infection control and call the attendant.
Thank you. Adir,
Hey.
can you do me a favor?
Yeah, what's up?
We need to have room 45 prepared for a potential Ebola patient who's out in triage. Can you please go do that for me now?
Yeah, sure. I'll go do that right now.
Thank you.
Yeah.
The clinical assistant assigned will first remove the computer and IV pull and pump from the room. It is important to hang the appropriate precaution signs on the door to room 45, including airborne and contact precautions, so hospital personnel can take necessary precautions before entering the room. Place the metal cart inside the exam room door for supply drop-off. Next, the CA should roll the Ebola virus cart, located in the hallway by the elevators, down to the cold zone, which is located right outside room 45. The CA should place the commode inside the bathroom. The patient should be instructed to use the commode and not the toilet. Waste needs to be disposed of properly. Retrieve the curtain from the closet and hang it. This delineates the hot and warm zones. Place a red biohazard bin in the cold zone.
Okay, thanks. Okay, they're getting that room ready. I just have to put on my gown and then we'll go back to the other room. Okay?
Thank you.
Okay.
As soon as the call to the charge nurse has been placed, the triage nurse must locate and don the gown, gloves, and mask located behind the triage desk. Once wearing the proper protective garments, retrieve the wheelchair. Instruct the patient or guardian with small child to sit in the wheelchair and explain where you are taking them.
Okay, hon, I'm gonna have you have a seat right here in the wheelchair and we'll take you back to see the doctor in the other room, okay? Let's put these down for you. And Mom, you stay right with us and we'll go back and talk to the doctor about what's been going on.
It is the job of the triage nurse to explain why the hospital is taking extreme precautions and to keep both patient and guardian calm.
All right, so Mom, we're gonna go into this other room.
Once the patient and the guardian have been wheeled to room 45, the triage nurse should show the guardian both the call button and the bathroom.
So this is the room where the doctor and nurse will come in to see you. Okay, you can have a seat right up here, hon, okay? Just make yourself comfortable. There's a call light here. If you need anything, just press this little red button. the registration person is going to call into the room to talk to you, to get you checked in.
Once the triage nurse has wheeled the suspected Ebola patient to room 45 and closed the door, they should promptly dispose of the gown, gloves, and mask into a biohazardous waste bin and sanitize their hands with Purell.